Okay, the station here I'm going to cover right now is on CHG bathing. So that's just a chlorhexidine bathing that we do once a day. And on 5 North, we just started initiating, something new to ensure that our patients that have central lines or midline catheters or ports, or if they have indwelling urinary catheters, that we're making sure we're keeping up a maintenance care. There's a board at the very front station of the nurses, right behind the nurses desk. And it's a whiteboard, and we have marked every day each patient on the unit that has under each category in what room, which one has the indwelling urinary catheter. So we're making sure that we do the pericure twice a day. And so we'll end up then marking the date and the time, and then putting a check mark, and then making sure we document as well. And then the same thing goes with patients with central lines. We have their room numbers, and then next to that is that the date and the time and the check mark as well when it's documented that that's been completed. So right now we'll talk about the CHG bathing, and that's extremely important for our patients that have central lines, PICC lines. They come in with ports, implanted ports, whether they're accessed or not. They still need to get the CHG baths because it creates like a barrier in the skin for up to 24 hours, and that helps prevent against bacterial colonization. So that's why it's so important that we make sure that we keep up on doing that daily. So what we need to do is to have our supplies in place to do CHG bath, and that would be our disposable cloths here, and then the HIPAA cleanse, and then we have the pump dispenser as well. And then as well as that, having that, we also want to make sure that we have a basin in a room. And if you have a shared room, just make sure that you have it marked, like bed A, the room number, bed A, and then the room number, bed B, so that we don't mix up basins. Just, to prevent against, contamination. We always want to make sure that we have a plastic liner lined inside of the basin. And then we're going to fill the basin up with warm water first, and not add anything. You're not going to add the CHG directly to the water because then you're diluting it and you're decreasing the effectiveness of it then. So what you'll end up doing is then taking at least 6 of your disposable cloths. So you would just put those in ahead of time into your warm water. Okay, and then what you're going to do is you're going to dispense then as you're cleaning each portion. So you're going to avoid the genital area, the rectum, and then any open wounds or any open sores. So you'll want to make sure that you end up taking one cloth, this dampened, squeezing it out, and then you're going to dispense the HIPAA cleanse directly on the disposable cloth, and then use one for each extremity done. So then that gets thrown away. Then the next one, same process. You'll use it on the other, extremity, and then you'll end up using it on the torso. Would be the third one. Again, avoiding the genital area or any open sores or any open wounds. And then one for the legs. Each one gets disposed of after, and then one in the back then, and the run and neck. So then you're going to use 6, and then after that, you're going to end up taking your basin, and you'll end up rinsing it out and then filling it up again, and then putting 6 more cloths in with the more warm water, and then you're going to end up then rinsing the patient. So that will still stay on, but you'll end up just using then 6 more. So it actually is probably more helpful if you end up just throwing the 12 in to begin with, and as long as the water doesn't get cold in the meantime. Then at that point, then, if you notice it's starting to get cold, then you'll want to change it out. And then, but as long as, you end up doing it in a timely manner, then you'll just end up using the 12, at once. And if the water's warm, then you'll end up then rinsing it off each extremity the same way that you ended up, just to make sure that residue, that residue comes off that. Is there any questions regarding documentation? Do you know where that's documented? It's documented there under flow sheets, under daily cares. So it's very important that you document that we're performing maintenance care on these patients. Okay. Any questions at all?
Is the goal of doing it in that order to actually leave the solution on each limb and then go back and rinse, or?
Well, to do it in that order is just to make sure that you're kind of, you have an order to do it, yeah, and to leave it on just maybe for that few minutes. And then it creates that, the protective barrier, and then you go back after. And like I said, even though you're going back and you're rinsing it with another damp cloth after, it just removes it a little bit of excess, like residue, so there's no irritation to the skin, but it's still, film will still remain in the skin, protect the patient.